Hello, everyone. I am so delighted to be with all of you, the Partners of Change of PMNCH. Today's video is pre-recording of a deep dive, a presentation of the progress report and two spotlight deep dives. On one is the Global Forum for Adolescents and the 1.8 campaign, and the other is on the Collaborative Advocacy Action Plan in our 10 countries. And so I will be assisted with these deep dive presentations. But now I would like to start and say that we are doing this so that you can look at more of a deep dive at your leisure, and that I will be looking forward to seeing many of you at tomorrow's, at Wednesday's pre-board webinar, and which we will highlight a summary of this slide deck and also go more through the agenda of the board. So that leaves us then more time for questions and answers. So let us then start without any further ado on this presentation. And so we're going to the next slide, and there is a brief history. And the next slide, you will see a little bit of our history. We were established in 2005, and PMNCH was then merged by three partnerships at the time. And so there was an agreement to then focus on the continuum of care for women, children, adolescents. And the 2010 was critical in order for the development of the Every Woman, Every Child strategy. And as you know, this was under the leadership of the UN Secretary General. We then updated this in 2015 to the Global Strategy for Women, Children, and Adolescent Health and Well-being in order to then prepare ourselves for the SDGs, and on a really strategy that focused on survival, thrive, and transform. So this prepared as well for the SDGs, and we then embarked. In 2019, the PMNCH has been critical in ensuring that UHC-PHC delivers for women, children, and adolescents, and that this be made explicit. And the 2020 was also critical for our partnership because COVID was then upon us, and we needed to make sure that the efforts to deal with COVID did rightfully focus adequately on women, children, adolescents, and a vulnerable population. So in 2022, we had a new approach on commitments to building on existing initiatives and really harnessing and focusing on accountability and advocacy in doing more, because after COVID and also climate change and also economic crisis and conflicts, we found that women and children and adolescents were paying with their lives. So this was something that was not going in the right direction. So we are at 2023, where we have actually focused our energy on an area that has been invisible and that needed more attention, and that is adolescent well-being. The next slide shows very much the spirit of PMNCH, and that is that we gather partners and strengthen the networks and the platforms in order to enable partners to do more together than alone. And here you see our 10 constituencies, from academic, research, and teaching institutions to the UN agencies, where we get everyone to come together, each one having their unique part and playing more and strategically together. So the next slide shows our vision and mission, as well as our 3 priority area, which is MNCH in preventing stillbirth, to drive down preventable morbidity and mortality, including stillbirth, by advocating vigorously for the inclusion of essential MNCH services in costed country benefit packages. The other priority area is sexual reproductive health and rights, and here we uphold essential SRHR in interventions and ensure continuous progress in financing and equitable access to comprehensive SRHR packages. The last priority is the adolescent health and well-being, and here is to advance the health and well-being of adolescents by engaging, aligning, and capacitating partners around the adolescent well-being framework and related policies and actions. And you will hear more about what we've done to date, which is critical in making it visible. Next slide. This is our results framework from inputs to impact. We have built our work plan on highlighting outputs and short-term outcomes, and then we'll see what intermediate outcomes and high-level outcomes in order to then drive impact, which is reducing maternal mortality, reducing child under 5 mortality, and also adolescent well-being, enhancing that. So these are really what we have attribution and contribution, and this is what is delineated here. Next slide. So how are we going to do it, and what is our definition of advocacy? That is what this slide describes. It describes that our advocacy is threefold. It has to do with campaigns and outreach, which is amplifying and through events and campaigns and media. It has to do with bringing partners together, partner engagement and governance, to capacitating each partner, but bringing them strategically together in order to then be much more powerful together in advocating and accountability for women, children, and adults. And then there is the knowledge synthesis, and this is synthesizing knowledge and evidence for action and accountability so that we can drive more change. And how do we do this? We do this through digital communication and also through mechanisms of electronic mechanisms. Now, all of this is intended to influence better financing, better policies, and better service delivery for women, children, adolescents. Next slide. So none of these pillars are actually in silo, but PMNCH and its added value is all about bringing these strategically together in an orchestration that jointly influences and drives action for impact. And so as you can see, the campaign, the knowledge and evidence, and the partner engagement is not only looked at alone, but to strategically time-wise in a calendar and a sequence of events to influence for greater impact. Next slide. This now concludes a little PMNCH 101, and I will now go into the progress report of 2022-23, which is in the middle of our strategy period, 5-year period. So next slide. This gives you a snapshot of our work plan, which you will recognize is divided according to knowledge synthesis, partner engagement, and campaigns and outreach. And it has 2 years here, 2022 and 2023. You will recall that our budget from the executive committee and board was 10 million per year. And so you will see here that we have 10 deliverables, 3 under knowledge synthesis, 4 under partner engagement, and 3 under campaigns and outreach. And each of these have then identified in the first column deliverables, and you can then see what the budget and what the actual expenditure has been for every year in these last 2 years. So the results of this is in the next slide. So PMCH has raised resources for approximately 20 million for 2022-23, which is according to the budget. And then we have implemented implementation rate against available resources for 22-23 is approximately a little over 92%. And then going into 24 and 25, PMNCH has secured approximately 10 million, which is half of our budget for the 2-year period coming. And then resource mobilization work is ongoing and will of course continue next year. And you can see in the table what our major donors are and who have given what during the past biennium and the biennium to come. So next slide. This is our numbers, and so our results in numbers in one slide. And here also you will recognize that it's organized according to knowledge synthesis, partner engagement, and campaigns and outreach. And all of this is actually then done in order to influence 30 low middle income government commitments to women, children, health, and well-being, as well as 5 overriding either regional or global commitments. And an example on that is the COVID call for action or the agenda for action for adolescents. So these are examples of big call for action commitments that we have then put in place in PMNCH. And it is envisaged that according to the 5-year strategy period, we will have 5 of these, whereas the target for number of commitments is 30. So you will see here, and I will go a little bit more in depth, that all of our results are really increasing, both in outreach and media hits, and also people reach through social media, and increases in followers of our social media outlets. And then you will also see that in the partner engagement, we have been able to get much more partners together and increased and interested in various platforms, as well as then the knowledge synthesis of looking at a number of advocacy products. So we have made, we have either taken a lead on or amplified. So the next slide is really a deep dive on partner engagement in countries. And the intent of this, as you will recall, was to get partners capacitated and also their platforms used in order to create more results for women, children, adolescents. And here there is a high-level champion engagement of President Ramaphosa of South Africa, really taking a lead in the Global Leaders Network and engaging 10 different heads of state to engage. To date, there is positive signals from Senegal, Bangladesh, Denmark, Honduras, Tanzania, and France. But the idea moving forward is to engage them without creating a formal network. The other is the ministerial engagement. PMNCH has held bilateral meetings and is actually then following up with 13 ministers in order to ensure that commitments are increased or new commitments are mobilized. And the platforms are that we influence is World Health Assembly, G20, Women Deliver, UNGA, World Health Summit, and so forth. So this we have been very active in. The other area is parliamentarian engagement, where we have then been bilaterally following up and supporting speakers of parliament or MPs, and also the attended 4 in interparliamentarian union assemblies. So the grassroots engagement really includes collaborative advocacy action plans, which we call CAPS in short. And here we have started in 13 priority countries. And then we have mobilized for adolescent well-being commitments, which has been all of our Global Forum for Adolescents. And here we have 18 country government commitments, 2 regional commitments, 13 philanthropic, and you will hear much more about this later. And then there is partner engagement digital advocacy hubs, and this is a really game changer for PMNCH, the advocacy digital hubs So we have launched that this year, and we are creating these hubs so that our partners can be more expeditiously in contact with each other and get more information and know-how about events and evidence and so forth. Next slide. Here is a slide of all of our commitments. You will see the red dots are the commitments to action for women, children, adolescents, whereas the green ones are the Global Forum for Adolescent commitments. You'll hear more about the latter in a presentation that Anshu will give you a little later. Next slide. This is really a campaigns and outreach for action. It has to do with all of the events that we organize. GFA was really the biggest, and you'll hear a deep dive of that. But we had, in addition, 15 flagship events and 38 supported events. And we have a growing reach of 904 earned media hits with 158 cumulative potential earned media reach, and our reach now is in millions and billions. So PMSH is becoming very much recognized as a source of getting information out and connecting it with partners. You will see our events are very strategic, and also we have a calendar of events that we are able to carve out with all of our partners and prepare for and influence greatly together. Next slide. This slide highlights the knowledge synthesis products. The cross-cutting has been about scoping review for investing in women, children, and adolescent health. And, excuse me, the G20 policy brief on maternal newborn child health. And when you get this presentation, you'll be able to directly click into these products. Then we have an advocacy brief on prioritizing women, children, and adolescent health and in the climate crisis. And then our priority areas really focus on, for MNCH, has been a focus on preterm birth and born too soon, decade of action on preterm birth, and this was launched at the MNCH conference in Cape Town in May 2023. And then for maternal, newborn, and child, maternal, newborn health, key advocacy priorities. And because there was a lot of products that was published and launched in 2023, so we have actually done a WISE document that takes the common messaging and puts it in one place. The other is the high-level champion-led media OPEDs, the high burden of maternal mortality, by Helen Clark, our board chair, and Dr. Tedros, the DG of WHO, and then Maternal and Newborn Health in Africa, published by Thomas Reuters, signed by His Excellency President Cyril Ramaphosa of South Africa. So in the SRHR, there has been an advocacy brief, and this will be critical in our preparations for next year in the ICPD at 30. So that focused on why sexual and reproductive health and rights are essential for universal health coverage. And dear partners, remember, if we are not explicit about women, children, and adolescent health, it gets invisible, and what gets invisible does not get addressed. So this is our job, all of us, to make to necessitate that adequate knowledge, adequate data, adequate focus is made on women, children, adolescent health. Next slide. The other is the accountability for action, and here there has been done a lot. The progress reporting by WHO, UNICEF, and UNFPA, the Countdown 2030, and PMSCH's progress report on the global strategy for women, children, and adolescent health. This was then launched at the World Health Summit last year in October 2022. And an estimated reach on this project is 860 million today. Then we had the capacity building activities in collaboration with partners on the latest country profiles and other data tools to improve progress on women and children, including through the UN high-level meeting on UHC and knowledge sharing for the National Volunteer Review organized by UNDESA, a thematic actionable accountability blogs. And then there has been work that has been put in on developing a compendium of UHC commitments, because as you will remember, our board decided that we are not going to brand commitments, but use existing commitments and follow them up. So mapping UHC commitments at global, region, and country level, and outlining accountability mechanisms available to multi-stakeholder platforms in advancing the implementation of UHC commitments. This is a priority for PMNCH. And especially in our CAP countries. Accountability portal is also being designed, and this is to enable you all to really access accountability resources and to better work together, and provide you with evidence on materials, briefs to facilitate peer learning and capacity strengthening for partners to use in their accountability and advocacy efforts. Next slide. This is, as I've said, we are trying to do this digitally, so we are in better contact with all of you and provide you with a place that you can go at any time that suits you in order to get information that connects and really be active. And so this is the update of the digital advocacy hubs. So the concept started in 2021. And then in 2022, there was contracts and phase one rollout. 2022 was about second rollout, which you see at the top there, the increase in a number of users. And then looking ahead, we are going to now continue and start these at country level with our collaborative advocacy action plan. So I'm looking really forward to that, because that will enable you to connect and really provide information and get information as needed to capacitate really your needs the best possible way. Next slide. I want now to go and tell you a little bit update about our governance. And we have, under the leadership of the Governance and Ethics Committee, there has been two pieces of work that they have overseen. One is the governance reform light touch assessment, which was really to look at ways of, are we in our governance reform, has it borne fruits as we intended? Is there anything to course correct on a light touch basis? The other was called Good Governance and Good Management, which was a direct effort by the board that requested the GEC, the Governance Ethics Committee, to really ensure that the way that PMNCH operates is under good governance and is also the Secretariat under good management. So this was then both of these pieces of work really started beginning of 2022 and have gone out until now. And as also had the opportunity of providing a survey. So let me just say, for the good governance work, there was 50 variables that were looked upon, and the results shown on the right, there was 0 in red and 16 yellow and 34 in green. So there were very good results as the consultants concluded. And now there is efforts put in place in order to get the yellows to become green and the greens to remain being green. So this is in very many areas. There's also we also had a very positive feedback from the 50/50 global report, where PM&CH has ranked very high performer consistently over the 4 years. And then of course our MAIE, which is Meaningful Adolescent Youth Engagement. PM&CH is a global leader in MAIE and one of the founding fathers of the checklist, and also now available guidelines and also an accountability report. So this is the things that we take very seriously and try to deliver on. So one is the results of the recommendations is one, streamlining of governance structures. There was highlighted that too much time is spent on many structures and also a lot of meetings. So here the recommendation was to the merger of the Knowledge and Evidence Working Group with the Accountability Working Group, and then to strengthen alignment between structures, for example, foster common meetings and so forth between PEC and SEC, which is the partnership, partner engagement in country committee with the strategic advocacy committee, and then the EC, which is the executive committee with the Global Forum for Adolescent Global Coordinating Committee, and so forth. And then third was to reduce the number of ad hoc working structures. So 2 is updating a range of governance related policies and integrating them into PM&CH's governance manual. So in other words, dear partners, to make things very explicit. And 3 is to increase governance management, secretariat efficiency in key areas such as more clarity on role and responsibilities across management and governance structures, and facilitate a stronger partner-led approach. And then fostering a healthy work-life balance among partners and the secretariat, including soliciting support from PM&CH partners, with, for example, reducing number of time-bound structures and also number of meetings. So this has really gone very well in ways now. And the Governance Ethics Committee has just overseen a status of all of the targets that were set by the LTA, by the Light Touch assessment, and their status of implementation, which is very high. Next slide. So this is then agreed actions, as I have said, on the mergers and the status, which I have also alluded to, that there are joint meetings and there is ongoing reducing number of individual task teams from 80 down to 30. So this is really, we have been able to keep the targets. Next slide. And then there will be the policies, updating of the governance manual to include then the diversity, equity, inclusion policy and the code of conduct, and also value charter. So this is all underway and will be ready, I think, at the end of the first quarter of 2024. So this is actually what we have. Next slide describes then the increasing efficiency of not only the governance, but also the management secretariat. Here there was to improve clarity, as I've said, to also reduce number of meetings down from 240 a year down to 140. We have already seen the benefits of this. And then to reduce 5 structures to 4 with the merger of the Knowledge Evidence Working Group and the Accountability Working Group to Evidence and Accountability Working Group, and then to reduce the number of task teams down to 30, and then with the full rollout of the digital advocacy hubs, which I think will also provide a lot of efficiency. So as you can see, the status of the updates I have given you already, And so we have also light touch support. Secretariat has begun to providing lighter touch support to steering committees and working groups, standing committees and working groups and chairs. So no less scripting, and also partners have taken much more of a lead, like we have in the example of the donor and foundation constituency taking a lead on the G7, and the adolescent youth constituency taking much more of a lead on the agenda for action. So staff-led solutions, staff retreats have agreed on creating weekly blocks of no meeting a time, and agreed modality for streamlining internal communication, reducing after hours work. Next slide. So this is the summary of some of the actions that you will see of the governance work moving into not only at the end of the year, but also the first quarter of 2024. So streamlining governance will be really a merger, as we've seen, and then also SAC-PEC meetings, and then continue operations by reducing ad hoc structures will be at the end of this year. Goal 2 will be updating of governance policies. That will be at the end of the first quarter of 2024, and then increasing secretariat efficiency. Organogram will resemble much more, hopefully with the governance structures that have been pulled together, and so that is what we are hoping to do. But as you know, the new executive director that is coming after me will have the pleasure of actually designing more of the secretariat's structure in the new year. So let us now go further. I have some good news, and that is that our membership is just increasing. So from the start of 2020, it was 1,040, and now it's 1,431. So this is an increase of 37.6%. And as you can see from the right hand, the biggest constituency is the NGO, as well as then 194 is the academic research teaching institution. So this is a partnership that is growing, and hopefully with the digital advocacy hubs and our structures will be very effective in bringing partners together for a greater change for women, children, adolescent health. Next slide. So here is then the secretariat update. We had the same survey done on us, and the light touch assessment pretty much found that partners felt well supported by high quality secretariat. Reducing governance structures and meetings can improve productivity, streamlining efforts and reducing workloads both for partners and for the secretariat. So we have been very serious about that and have put several things in place. And then the MIND, Good Governance, Good Management survey, which then covered 75% respondents rate, had then out of the 50 variables, 0 in red, only 9 in yellow, and 41 in green. So we put in measures and looked at and at the retreat to see how we can then take the yellows into the green and then maintain the green, the positive, very positive results. So secretariat will maintain positive greens and then see a little bit more on role clarity, more effective organizational communication across teams, which we hope to reduce in the new year, and a greater prioritization to navigate and reduce high workload volume. We have had 2 staff retreats focusing on the governance results and as well as our own results. And we have identified some measures which we have put in place, increasing staffing level, establishing no meeting times, and increasing clarity on team and individual roles and responsibility. Staffing level have increased by 28%. From 2020, and currently we count 25 staff and consultants, of which 31% are under 30 years. And then the staff organogram will also be looked at upon, as I said, but we will await the new ED. I just want to use this opportunity once again to thank all of my members of the Secretariat. This is an excellent team that punches way beyond its weight and very much active and here to service you in any way possible. So I think that was my last slide. Let's see. Yes, that was my last slide, and I will now hand it over to Anshu Mohan in the Secretariat to give you a deep dive in the Global Forum for Adolescents and the 1.8 billion campaign for change for adolescents. And this is something we are very excited about. So from my side, then I shall then pass the baton on. And I hope to see you all at on Wednesday at the pre-board webinar. Thank you.
Thanks very much, Helga. Good morning, good afternoon, good evening to all colleagues on the call. My name is Anshu Mohan. I am the Senior Strategic Advisor at the PMNCH Secretariat and the team lead for the 1.8 billion campaign. And I'm very pleased to be speaking to the Global Forum for Adolescents, which is a key milestone for the 1.8 billion campaign. Before I go into the details of the Global Forum for Adolescents, I'd just like to speak a little bit about the multi-pronged approach that PMNCH used to drive forward the campaign. This was rooted in evidence, so that was one of the prongs. We of course know that for early adolescents and late adolescents, there isn't much evidence, so bringing together evidence on that and also bringing evidence from other sectors and stakeholders was an important part of this campaign. The second prong was political mobilization through working closely with partner governments and also with UN agencies and using a multi-sectoral approach, for example, working closely with education and nutrition. All of this underpinned by the principle of MAE, meaningful adolescent and youth engagement, making sure that young people were firmly in the driver's seat, designing the campaign with us shoulder to shoulder. So my next slide speaks a little bit about the various figures that have come out of the Adolescent Wellbeing Campaign. For example, more than 50% of the registrants for the Global Forum were young people. In terms of social media reach through the PMNCH channels, we've had a reach of 2.9 million. On the 1.8 channels, we've had a reach of 3.5 million. The Global Forum for Adolescents saw commitments from 18 countries, 2 regions, and 14 non-state actor commitments, including the donors and the foundations. It had 3 plenaries, 22 sessions, 130 speakers, approximately 120 leading partners, and 125 national events. All this complemented by 19 hours of content, music, discussions, and much more. We've had multiple media hits, 49 so far, 8 product launches, an art competition which saw 9 winners across multiple categories, so film, music, and spoken word, and hundreds of partners involved. So overall, this is just a quick snapshot of the wide partner engagement and the support that has been there for the Adolescent Wellbeing Initiative. To quickly give you a sense of the discussion during the GFA, and this is a snapshot of the thematic sessions, the 22 core sessions, which were designed by the Program Action Working Group, co-led by our young people as well as UNICEF and UNFPA, and it saw a spectrum of issues. For example, mental health was upright there, menstrual hygiene, parenting skills, online safety, violence, sexual orientation, gender identity, CSE, nutrition. So an amalgamation of issues speaking very much to the various and all comprehensive domains of the adolescent well-being. There were 8 product launches at the Global Forum for Adolescents, some driven by PMNCH and partners, and some inspired by the work that PMNCH is doing on the adolescent well-being framework. For example, the adolescent well-being investment case, the adolescent well-being measurement approaches and indicators framework are all work that are being led by PMNCH and partners. Global AHA, the updated version led by WHO, PMNCH, plus the other H5 partners. In addition, we had the likes of the Continental Strategy on Education for Health and Wellbeing, which is very much an intersection of education and health and speaks to the strengths of the adolescent wellbeing framework. This is an EU-wide strategy which has been inspired by the adolescent wellbeing framework. Similarly, the first adolescent strategy for the United States, domestic inward-facing strategy that addresses the needs of adolescents in the US. There was a launch by the NCD Alliance speaking to fortification of food and marketing of unhealthy food, in just to be very specific. Then the preview of Adding It Up, which is a report by the Guttmacher Institute, which is going to be released early next year. In terms of engagement, we saw huge engagement at the Global Forum for Adolescents, more than 9,000 registrants demonstrating widespread interest. And as I said earlier, 55% of these were under the age of 30 and more than 50% engaged during the Global Forum for Adolescents. Each core session had a viewing of 300 to 500. Plenaries, of course, were much higher, ranging from 1,400 to 800, and still we have content which is available on demand. There are links on the slide, and we will pop them in the chat for you to see the content at your convenience. And we've said this before, that the Global Forum for Adolescent was one single milestone, but we continue to engage with partners leading up to the Global Forum, encouraging national partners to organize events in support of the Global Forum for Adolescents. So we've had 125 events till date, and these are spread across different regions. For instance, we had 42 events in the Africa region, 26 in Latin America, 24 in Southeast Asia region. Mediterranean was a surprise. They had regional as well as national event, and there was a lot of support coming out for adolescent well-being in this region. And we appreciate there are some countries that still don't acknowledge adolescents as a specific population group. So it was really, really heartwarming to see the support that came in from the region. So we had, of course, the Western Pacific region, where we had 4 events, and the Euro, where we had 13. This was complemented by 2 global and 2 regional events. The engagement through national events was more than 7,000 people, making the engagement leading up to the GFA for more than 12,000 people. So overall, very, very good support and very good country-based engagement for this issue. And this was reflected in the commitments, the first wave of commitments that have come through at the GA and also at the Global Forum for Adolescents. So 18 government or national commitments supported by 2 regional commitments, the AU and the EU. And as you will see, the commitments span across various geographies. For instance, you have Asia, Africa, Europe. You also have Latin America and North America. The commitments spread across various domains of the adolescent well-being. Primary focus is SRHR, meaningful adolescent and youth engagement. There is violence that also comes across, or addressing violence. That is also one of the areas of commitment making. And there is participation in civic processes. In addition, we saw 14 non-state actor commitments. This is just a snapshot. For more details, please do visit the website. We'll pop the link in the chat. One of the big outcomes of the Global Forum for Adolescents is the Agenda for Action for Adolescents. This piece of work started more than a year ago and is a triangulation of various engagements plus evidence that has come out of the various levels of work that PaymentCH has done. For example, the BMJ collection, the multi-stakeholder consultations, the recommendations that have come out of the investment case, and also the measurement approaches. In addition, there is, of course, the centerpiece, which is the voices of more than 1.2 million adolescents and youth who have been very vocal on what they want. Findings of the What Young People Want campaign demonstrate that more than 40% of young people actually want employment, education, and skills, and to have to be able to provide for themselves and to be and to be able to be the best version of themselves. The Agenda for Action for Adolescents was drafted by an expert advisory group, including PaymentCH youth leaders, members of the PaymentCH Standing Committee, and the working groups and the program action group of the GFA. This was launched in the closing plenary of the GFA and is the fuel for the 1.8 billion campaign going forward. I'm going to just quickly go through the 7 asks that are the pillars of the Agenda for Action for Adolescents. For example, there is the big ask is on provision of universal primary, secondary, and tertiary education and vocational training, very much aligned with the findings of what young people want. There is, of course, the second ask on provision of affordable, high-quality adolescent services for health and well-being at different levels, including through primary health care, through schools, and community-based services. The third ask focuses on ensuring mental well-being and resilience and provision of timely, flexible services which are accessible to all. The fourth is a much larger ask and speaks to the reform and legal action, for instance, reformation in harmful and punitive laws, focusing on ensuring that age of consent laws do not deprive access to essential SRHR services and information, including HIV services, contraception, safe abortion, and also protecting child against early and forced marriages. The fifth ask is in continuation of the fourth ask, speaking to strengthening and establishing of social protection services and policies, mechanisms that meet the unique need of adolescents, for example, through safety nets for vulnerable children, cash transfers, and food security. The sixth task is around prevention of stigma and discrimination and provision of comprehensive sexuality education in and out of school, emphasis being in out of school as well. And finally, the last ask is strengthen agency of adolescents and youth through providing meaningful social and civic participation and allocating adequate resources to support youth and adolescent-centered accountability mechanism across various levels and through various institutions. And what we have also agreed as PaymentCH as a community to do to support the 7 asks, and details of these can also be found on the website, but top of the line are facilitating meaningful engagement of adolescent and youth groups, promoting co-leadership, compiling evidence on adolescents and youth experience, promoting integrated all of the government planning, which is one of the key challenges in moving forward the adolescent well-being agenda, supporting endorsement and discussion and dissemination of the Agenda for Action, and finally mobilizing measurable commitments, the key piece where we will see financial and policy commitments which will lead to impact at the ground level. There is the summary of commitments against the 7 asks also available on the PaymentCH website, and we will put the link for you to review in the chat as well. But the big question is, what now? We've just come out of a very intense exercise over a 3-year period where we have built the campaign and the Global Forum for Adolescents, which saw huge engagement. So just a quick preview of the next steps for the campaign. The board meeting, as we all know, is just around the corner, the 27th and 28th of November, where the board will meet to discuss, amongst other things, and agree on an adolescent wellbeing global strategy paper on the implementation of the Agenda for Action. This paper builds on the commitments made at the GFA. The expected outcome of the discussions at the board is creation of an action plan on adolescent well-being, spanning a 2-year period of 2024 to 2025 to take forward the Agenda for Action. And this will include focus on commitments, which is support the mobilization of new commitments and accountability for implementing commitment made. National events, to continue national events, but in a much more focused way, in support of commitment mobilization and implementation, also bringing in the accountability elements through the national events. Knowledge products, which have been underpinning all the work of the 1.8 billion campaign to finalize the investment case and the indicators related work. Finally, the fifth piece is accountability, a more broader accountability for adolescent health and well-being commitments through periodic reporting and voluntary national reviews. All of this comes tied together with an advocacy roadmap, highlighting key milestones where we take our commitment mobilization moments, where we take our advocacy moments forward. For example, the World Economic Forum, ICPD F30, WHA, UNGA, and the Summit for the Future, etc. So with this, I conclude and hand it back to you, Helga. Thank you very much.
Thank you, Anshu. My name is Sue Mbaya. I'm the lead consultant on the Collaborative Advocacy Action Plan project, and I'll be taking you through a deep dive of the progress so far with the CAP process. And so just an overview of the process, how we've come to be where we are, recalling that about a year ago, in July 2022, the board approved the development of the new approach on commitment mobilization and follow-up. And the idea was that we had recognized that in order to precipitate progress on women, children, and adolescent health indicators, something different had to be done. And so at PMNCH, we reviewed the way that we work with partners in progressing health outcomes for women, children, and adolescents, and made these changes and proposed these changes in something that we call the revised approach. And that was approved by the board in July 2022, triggering a process of implementation culminating with where we are now, where we are reviewing the progress that's been made with the first batch of countries. Next slide, please. And just to say that the countries that are currently involved in implementing the CAP process, we have 10 countries that are currently implementing the CAP process as indicated on a previous slide. But as we proceed, you will see that we have 3 additional countries that are also involved in a CAP-like process, but more on that in a few moments. So what distinguishes the CAP process? There's some important guidelines or principles that we are observing as we implement the CAP process. Essentially, one of the key engagement principles is that we recognize the leadership of partners in the country, in the relevant country, and partners may mean government or other parties in the country. We aim to build or to strengthen existing national multi-stakeholder platforms rather than creating new ones. Where they exist, we strengthen the multi-stakeholder platforms that exist so that the collaborative effort, the CAP process, is based on a multi-stakeholder platform in each case. We want to ensure inclusive and meaningful participation of countries within partners within the country. And that often means expanding multi-stakeholder platforms that exist to ensure that they include as broad as possible a spectrum of partners, to include as many of the 10 PMNCH constituencies as possible. We also want to champion transparent communication and openness of the process. In that way, we want to ensure mutual accountability. So often we talk about accountability of governments in implementing the commitments, but in the CAP process, we also want to talk about accountability within and among partners as well, and that is reflected in the final of the principles that we're observing, and that is one of monitoring progress, ensuring that there is accountability for results that would have been agreed at the beginning of the process. Next slide, please. And so the CAP, you will recall, is a 5-step process. And I will just give a quick overview of where we are with each one of those 5 steps. The first step has to do with identifying a lead partner or a coordinating partner in each country. And this is a partner who has got specific criteria, who meets specific criteria that are agreed. And this has been achieved in all 10 countries where lead or coordinating partners have been identified. We have also identified coordinating partners in Ethiopia, Niger, and Mali, who we have added as the 11th, 12th, and 13th countries that we are working with. The second step has to do with identifying a functional multi-stakeholder platform, which would be the basis of the collaborative effort. This involves applying a checklist for the identified MSP to make sure that its functionality is robust enough to then house and support the CAP process. MSPs have now been identified in Kenya, Nigeria, South Africa, and Malawi, and are in the process of being identified in the other countries that are participating in the process. The third step of the CAP process has to do with mapping the commitments that have been made by governments, and then assessing the extent to which government has now proceeded in implementing those commitments. The status is that the mapping and assessing of commitments is now underway in Kenya, Malawi, Nigeria, and South Africa. And it's very exciting that in these countries we're simultaneously introducing our digital advocacy hubs, so that they're the basis, as much as possible. The digital advocacy hubs become the basis of the collaborative engagement, information sharing that takes place as part of the scoping and assessing of commitments. The fourth step in the PMNCH revised process is the development of the actual CAP. That's the Collaborative Advocacy Action Plan itself. This is yet to be undertaken. CAPs will then be produced in response to the findings of the scoping and the assessment, and we're yet to reach that point in any of the countries. Similarly with the fifth step, which is the periodic reporting by the lead partner, yet to take place. Next slide, please. So what will success look like? In all the countries that are participating in the CAP, our aspiration is that we would like to see existing women, children, adolescent health commitments which have been made by governments being followed up. We would like to see new or additional commitments mobilized where they are required. And as previously agreed or recognized, in most countries, new or additional commitments will be required in the area of adolescent well-being, which is really underrepresented in commitment matrices in most countries. The third indicator of our success will be that multi-stakeholder platforms that focus on women, children, adolescent health will be expanded or strengthened to include as many of the 10 PMNCH constituencies as possible. And it's not just about extending them in terms of representation, but in terms of functionality as well. And this may include the way that information is handled, the way it's disseminated, the inclusiveness of views across the MSP. These are some of the indicators of functionality of the MSPs. And then an additional indicator of success will be the development of the CAPs themselves, where we have CAPs being developed, and that they become the basis for the collaborative advocacy that's required to see governments making progress in implementing the commitments that they have made. And then the last indicator of success will be the advocacy priorities that that partners rally around. I think that the CAPs will also be useful in not just rallying partners for advocacy, but even resource mobilizations. If you consider, the donor constituency, their involvement in the in ongoing advocacy, processes will be facilitated in many respects by the CAPs themselves. Next slide, please. And so let's just take a deep dive into the process so far and what has been achieved so far in each one of the countries, just very quickly. In Bangladesh, where we have the White Ribbon Alliance as the coordinating partner, proposal development is commencing. In Ethiopia, where we have CHAI, the Clinton Health Access Initiative, as the coordinating partner, contracting is underway. And this is one of the additional countries that will be focusing on adolescent well-being, highlighting the need for commitments around adolescent well-being, but using the CAP process. And so contracting is underway. In Kenya, we have the Health NGO Network, or HENET, as the coordinating partner. Commitment scoping is underway. And we have a special innovation in Kenya. The Aga Khan University will be undertaking the first two steps, of the CAP process, the commitment scoping and mobilization as the academic partner to HENET. In Liberia, where we have the Public Health Initiative of Liberia, contracting is underway. In Malawi, where we have Amref Health as the partner, the commitment scoping is underway. In Mali, where we have Muso Health as a partner, commitment, the proposal development, which will allow the contracting to then take place, is now underway. In Niger, similarly, we have the proposal development commencing. In Nigeria, this is one of our leading countries, where we had the Africa Health Budget Network as the coordinating partner. Commitment scoping has taken place and assessment is now underway. In Senegal, where we have Amref Health as coordinating partner, contracting is underway. In Sierra Leone, where we have CHAI as the coordinating partner, contracting is underway. In South Africa, where we have Sasquatch as lead partner, supported by CHAI as the secretariat, commitment scoping has undertaken, assessment has been done, and the assessment report is now being revised after inputs, from partners, also a leading country. In Tanzania, where we have the CHAI as the coordinating partner, contracting is underway. And finally, in Zambia, where we have Amref Health as a coordinating partner, proposal development is underway. And so, as you can see, we have a range of status. And each one of these countries, from each one of the processes, we've been able to learn some lessons, which I will now share. Next slide, please. And so we've categorized the lessons learned so far and tried to assess the implication of each one of these lessons for how we're going to undertake the CAP processes in future. So there are a few overall reflections that I will mention. First of all, we've noticed that the CAP process is, as we had hoped it would do, it is providing greater visibility for PMNCH at country and regional levels. This means that the CAP processes are demonstrating the value add of PMNCH by allowing partners to be better aligned and the voices of partners to be amplified. A second learning is that the implementation of the CAP process is very, very context specific, and it is a political process. And this requires that there is flexibility in response to the context in each one of the countries. And a very closely related learning is that the CAP and adolescent well-being processes in each country need to be better aligned moving forward. That means that with the GFA now having been finalized, it will be important to fold the efforts which are being undertaken under the GFA into the CAP process, so that we capitalize as much as possible on the progress that was made and the momentum that was unleashed, by the GFA. A second set of learnings has to do with our partner engagement. We've noticed that it is really, really important to socialize the CAP process with government at the very outset, and that this is critical. And in fact, the engaging governments in the CAP process is a delicate balance, because the CAP has a very specific focus on accountability and reporting progress, and accountability is sometimes a source of contention between civil society and government, and so that there has to be maturity and sensitivity in the way that these dynamics are handled. Another learning to do with partners has to do with the selection of lead partners themselves. It in itself is a political process, and that it has to be handled very, very transparently, with government being appraised and making sure that the terms of reference and the expectations are well communicated and well understood as we go along. Finally, we've also learned that the CAP process is really, really creating opportunities for underrepresented constituencies, especially adolescent and youth-led organizations who are being well incorporated into some of our CAP processes. Next slide, please. We also have learnings that have to do with the administrative and financial support by PMNCH to partners. What became clear was that the CAP process will require more support to countries than initially envisaged, and this includes financial support. We're seeing that a minimum of $10,000 and upwards is required by partners, and we had originally anticipated that partners would be able to provide financial resources to the CAP processes. However, the global economic climate has had a tremendous impact on access to funding by most of our partners, and so it's clear that budget needs to be made available. So a learning from this is that at the beginning of each year, PMNCH has to be very clear about budget allocation for the CAP process, and that this has to be communicated clearly to partners ahead of commencing the CAP process. Some great learnings, for example, in South Africa, PMNCH facilitated financial and secretariat support to the lead partner, as previously explained by Chai. And so this has shown us that the CAP process does have the potential to facilitate resource mobilization domestically for partners. Maybe not so great is just a reminder that the WHO procurement process, which is what we use as PMNCH, is fairly onerous, in that we have to budget and build in time for this process to be undertaken and finalized, and we had not done this at the outset. In-country partners are encouraged to co-produce a digital compendium, which we had not done before. Previously, we had understood that the digital compendium, which provides a list of the commitments which have been made by governments, we had initially intended that the PMNCH Secretariat would make this available to partners. But it became clear that there's so much value add if partners are involved in the co-production of the digital compendium. And going forward, this is how we will proceed. And finally, around the in fact, let me just go to the next slide, please, at this point, and look at the lessons that come out of the scoping and assessment of the commitments themselves. Well, we've noticed that lead partners are employing very, very different contractual modalities. Sometimes they use their own staff, sometimes they hire in consultants, and sometimes they have research partners, as has been the case in Kenya. And so this has made it clear that the Secretariat, PMNCH Secretariat, has to provide sufficient support to lead partners so that there's clear guidance throughout, within the terms of reference of the lead partners, but also in the terms of reference for the consultants who may be brought on board, so that in spite of the modality that's used, there is some uniformity in the processes, the way that the process is proceeding across different countries. We have noticed that information on national commitments and their implementation status is not always easy to find, even at country levels. So moving forward, a range of, we are recommending that lead partners involve the full range of partners in country in the processes of scoping and assessing of the of commitments, so that the full body of knowledge that's available in country is harnessed as part of the scoping and assessment. Finally, we've noticed that the report of the scoping and assessment can be very rich, and it can actually be very, very comprehensive. And so it's become clear that the PMNCH Secretariat should develop an adaptable reporting template, which can help to package the results in a pragmatic manner, and in a manner that allows for comparison across countries. The next area of learning has been the area around establishing country hubs. And in co-designing the country hubs with lead partners, we found that there has been we found this to be a very positive, experience, rather than PMNCH Secretariat designing the hubs by itself. So going forward, engaging the lead partner on the development of the hub will be something that we try and do while the scope, the process of contracting is carrying on, so that the hub is immediately available at the beginning of the scoping process, rather than waiting until contracting is finalized before engaging the lead partner on the development of the hub. And so that brings us to the end of my overview. I hope that you'll find that this has been very, very useful. Thank you so much.